currently, there's no way to make a diagnosis of Parkinson's disease short of autopsy, and therefore you would need to do an autopsy of the brain to look for a protein alpha-synuclein and see if it aggregates. What we now know from whole body autopsies is that there is aggregation of alpha-synuclein in multiple different organs, including the submandibular gland, the skin, the colon, and other areas of the GI tract. And so there are a number of different studies that now have been done to do biopsies of the submandibular gland using a needle, a core needle biopsy, of the colon, and as well as of the skin. And the way the data looks at using immunohistochemistry to look at alpha-synuclein aggregation, probably the two best locations are the skin as well as the submandibular gland. The submandibular gland requires a needle biopsy, whereas the skin requires a punch biopsy, so somewhat easier. You can get enough tissue whenever you do a skin biopsy. And the exciting thing is that it is very sensitive and very specific for Parkinson's disease. And that's the same for both submandibular gland and skin biopsies. What's becoming even more exciting potentially is that we are now using seeding assays. So something called RT-QuIC is one of the seeding assays that we have been using, and you can actually get very high sensitivity and specificity for localizing alpha-synuclein in both the skin and the submandibular gland. So potentially a very simple way to detect alpha-synuclein in living individuals, which is something we've not been able to do as of yet. So from a diagnostic standpoint, there are a number of diseases that can look like Parkinson's disease, so that we call them Parkinsonisms. And those individuals often respond differently to different types of treatment, both medical therapy and surgical therapy. So being sure that we make the correct diagnosis is important. And these types of biopsies would be very helpful in that situation. The second reason biopsies could be important is that there's a lot of work on genetics, epidemiology, various different clinical trials of treatment. And since the diagnostic accuracy of Parkinson's disease is not all that high, let's say it's about 80% in more advanced cases, but early on it can be as low as 50 to 70%, having a diagnostic test like this would enable us to be sure that we're enrolling the correct patients into our studies. Finally, there's starting to be some data from our group and others looking at longitudinal biopsy studies. So we do a biopsy at the beginning and again a few years later, and we look to see if there's an increase in the amount of alpha-synuclein aggregating. If that's the case, this could be a disease progression marker, and we might be able to use it to indicate A, disease progression, but B, if we had some sort of treatment that stopped alpha-synuclein aggregation, we might be able to determine that using longitudinal biopsies.